Dr. Jen Malinsky is from the Harvard University Joint Housing Center, and is here to share with us a little bit about her report, which is nationwide in focus in terms of the state of housing in America, particularly as it pertains to older adults. But she's got some interesting ideas for a town like Harvard that has some specific challenges. We're definitely not urban, but we're not quite rural either. We're somewhere in between. So I'm looking forward to hearing what she has to say. So just get ready, Jen.
Thank you so much. Thank you, Katie, and thank you very much to the Council on Aging and the Friends of the Council and the League of Women Voters for having me today. Really appreciate it. As Katie said, I'm from the Joint Center for Housing Studies at Harvard. Just a little bit about the center. We were formed in 1959 as a Joint Center for Urban Studies with Harvard and MIT. And over time, the center migrated to be completely at Harvard, and we're now joint between the Graduate School of Design and the Harvard Kennedy School of Government. So we have a foot in both worlds, the planning, architecture, design, and the policy side. It's thinking about some of the same things that you are, very different city, very different size, but also thinking about aging and community and how to make it a better process, more high quality of life. So just a bit about our work. The motivation for our work on housing for older adults is the tremendous demographic shift that the country's undergoing with the aging of the baby boomers. Nationally, the population over 50 is growing dramatically. You can see how the waves by age are occurring. So we saw a big wave of people turn 50 starting in 1990. We're seeing this wave of those 65 to 79 jumping now. And looking forward, we expect to see a large jump in the population 80 and over when we go out a couple of decades. So that's kind of what motivated us. We have a very national scope at the Joint Center, but we haven't done much with senior housing in particular, and this was a great opportunity to do it and a good time. So right now we've got 1 in 7 in the US is 65 and older. By 2030, that will be 1 in 5. And right now, the group 75 and over, 1 in 16 people in the U.S. is 75 and over. By 2040, that'll be 1 in 8. So we're really looking at not only a population growth, but a shift in the distribution. That population is going to be increasingly ethnically and racially diverse, reflecting changes throughout the entire population. And this has some repercussions for housing, we think, because different people of different backgrounds often have different rates of living as multi-generational families, for instance. So that's something that we're definitely keeping an eye on. The other driver that we're looking at is that with age, there's some different risks that affect housing needs. So we know that disability rates rise with age, and that more and more people live alone with age too. So those are two things that we keep in mind as we think about if housing is well connected, if housing is accessible. And these there's a huge difference at the beginning in terms of disability rates by income, by whether you own or rent. But the point of these charts is to say that with age, things do converge. So this is really an issue for everybody to think about, regardless of where you start. So it's something that we try to keep in mind too. So I guess the premise of our work is that we view housing as a platform for a good quality of life, for health, for connection with your community, with your family, for financial security. And this is true for people of all ages, but because there are particular needs and interests and preferences of older adults, there are some ways in which it's really important for older adults. One is that the cost of housing is really tied to financial security and retirement and the ability to pay for necessities like food. And I'll show you in a few minutes that when you have too high of a housing cost burden, your spending on things like food and healthcare goes down. The physical structure of the house is very important because people have increasing rates of disability. Isolation can be an issue if we're not in connected, well-served transportation areas. And finally, the connections between housing and healthcare are important. So I'm going to talk about those 4 challenges: affordability, accessibility, connection with the community, and connection between housing and healthcare. And just a word too, before we begin. In most surveys, most people say that they would like to age in place. I'm sure you've heard that, and perhaps share that as well. And that's something that this report and the work that we do is trying to support. We use the term aging in community because we think that the house you're in may or may not be the exact right fit right now. It may perfectly well be, it may not be, but the idea for us is to look for housing solutions that help people stay in their communities and connected to their communities and to their friends and to their institutions and their families. Okay, so affordability is a concern for many older adults. As people enter retirement, again, we start out with a big distribution of incomes, but incomes basically fall and converge to about a median of $25,000 for people in their 80s. So wealth may vary, but incomes do collapse to a great extent. As a result, many households, particularly renters, but also owners, face housing cost burdens. That means that they're paying more than 30% of their income on housing. And you can see how these cost burdens rise with age. The severely burdened in gray on the bottom are people paying more than 50% of their income on housing. For owners without mortgages, the rates are fairly low, although they still do rise to over 20%, so it's still substantial. But one interesting thing that we found in this report is that owners who carry mortgages into their older years are, by their 80s, more likely even to be cost burdened than the renters. So that's definitely something that we're concerned about. Their cost burdens are definitely concentrated among those with lower incomes, but increasingly we find it creeping up the income scale, and we find it among owners even who have mortgages. Now, this is the slide I was telling you about before. When you have housing cost burdens, there's much less to spend on every other need. So less spent on food, transportation, healthcare, and for that pre-retirement group, much less spent on retirement savings, which is a problem. The housing cost burden is a problem now, but it's also sort of setting you up for a problem later on. So that's a concern that we have about housing cost burdens. And this, to get back to the debt issue, so we see that owners with mortgages are more likely to face these burdens and then have difficulty paying for other needs. We see that more people are carrying mortgage debt into their older years, and that the amount of that debt, the average amount of your mortgage, say, is going up. So there's a concern about the 50 to, I think one thing we found in this report is that the 50 to 65-year-old cohort is not as well prepared as their predecessors at their ages. And a lot of that has to do with being particularly hit hard, that age cohort, in the recession. But simply not as set up as their older peers. So on to accessibility. With a rise in age-related disabilities, the need for accessible housing expands, and more we're going to need accessible housing. What we've got right now is not so accessible. We have only 1% of the housing stock in the United States has these 5 common features. The thing you hear about most when you think about accessibility is single floor living, so no stairs, bathroom on the first floor, bedroom on the first floor. A no step entry, so there's no steps to get into the house. And then electrical controls, door handles that are the lever style, electrical controls that you can reach from a wheelchair if needed, and extra wide hallways and doors to accommodate a walker or a wheelchair. These are the common features of universal design, accessibility. So only 1% of the housing stock has all 5, 43% has 1 or more, very few have all of them. By age 80, your chance of having a disability is greater than your chance of living in an accessible house. This chart kind of is a national level look at things. In the Northeast, we have it sort of worse than anywhere else in the country. We have the oldest housing stock. We have a very hilly topography. We have the least amount of any of those features of any other place in the country. So the Northeast is particularly in need of some solutions for accessibility. Now, you've probably heard about universal design, things that are intended to make a house or an outdoor environment more accessible to everybody. Universal design is sort of a language that means that any environment should be accessible to everyone, not just older people, but also parents pushing strollers, little kids. everybody. And some of the interior features that, this is the electrical controls again, a walk-in shower, the no-step entry, the labor-style handle. Universal design is becoming more and more popular, especially since designers are putting a greater emphasis on it not looking institutional, making it look seamless, and that's what it should be. And some communities and states are seeking to address how do we get these into more homes? How do we make that 1% of housing that's fully accessible grow into more of our housing stock? So some of the things that communities are doing, and I'll share these because they may be of interest to individuals or to Harvard to look at. One is a visitability ordinance. I always trip on this word, visitability. But this is the idea that anyone should be able to visit your home, get in your home, be able to use a bathroom on the first floor, be able to navigate the first floor with wide hallways and doorways. And this movement for visitability started with an organization called Concrete Change out of Atlanta, Georgia, and has moved across the country with various cities adopting regulations that say anything from any new housing has to have a few basic minimum things, like a no-step entry, like reinforced walls in the bathroom in case somebody wants to add grab bars, to just merely advising. There's regulations that say if you're building in town, you have to read this about accessibility and about universal design. Pima County in Arizona is known as the one that's taken this the furthest. They've created tens of thousands of units of housing now added to their stock that have these basic features. So in the future, the idea is that this stock will be available and not just for older adults, but the whole housing stock should be getting more accessible for everyone. Some of these are at the state level. Vermont, for instance, requires these minimum features on all new housing. Other options to help people with accessibility concerns and to help communities, tax incentives. There are tax credits for homeowners in some states, grants or low-interest loans. Massachusetts does have one, a home modification loan program, and volunteer assistance. So it's kind of like Habitat for Humanity, rebuilding together. We'll put together teams of volunteers to help older adults make modifications to their homes if they can otherwise afford it. So moving on to the third challenge, connectivity. 75% of our older adults, and when I say adults, I mean adults over 50, are aging in suburbs and exurbs and rural areas. So we've got a quarter of people aging in central cities, but the rest are in much lower density areas, rural areas that are car dependent. And that would certainly include Harvard. Yet many adults do limit their driving, or they don't drive at all. So at age 80, there's almost a quarter of the population that doesn't have a car. And there's certainly over 50, a big chunk of the population that will limit driving in some way. You can see on this chart, which comes from the Center for Disease Control, that women are more likely to limit their driving than men, but that there's limitations at night in bad weather and heavy traffic on long trips. So the concern here is that people in rural areas, suburban areas that aren't walkable or transit friendly, who want to age in place may be aging in isolation. And that's not what we want, right? So how can we bridge that gap? How can we help the areas where people already are become more connected? And that's the idea behind a lot of movements that are happening, and a lot of efforts. I'll talk about some of them. And this is just to say that even if you have transit in your community, it may not be safe or accessible, right? So we think there's transit in cities, everyone's all set, but a lot of older adults may not feel safe. The transit is often geared towards working people with working people's destinations and timelines. So it may not work, and this is just a slide to remind us that even if you have a bus stop here, it's not maybe the most friendly, accessible place that you want to be on the side of a busy road. Excuse me. So some of the things that places are considering, of course, are buses and vans, Uber-type systems. There's an organization called the Independent Transportation Network, which is all over the country, but there's a branch up in Portland, Maine, that relies on a combination of paid and volunteer drivers. The transportation likely needs a regional approach, I would think, especially in a community like Harvard where you want to get to destinations outside of town, like the grocery store or whatnot. Those kind of solutions are being developed, trying to figure out how to make this as convenient as possible when people are low density and spread out. The other thing that people are thinking about is how can we make our existing towns have a little bit more resources in them that people want to go to locally. So I live in Newton, and I was a planner in Newton before coming to Harvard. Newton doesn't have a downtown. We have 13 villages, and we were trying to think, how can we build up those little villages to become more walkable destinations where you can get more of your needs met. And I'll show you a slide later on of one where we're planning to put some actual housing, some of it for seniors. But even if you do that, you need to be careful that it's in a pedestrian-friendly environment. This is a notion that's being touted in a lot of communities. It's called the complete street. And you can see that there are designated lanes for bikers. There are clearly marked paths for pedestrians. There are places to stop and rest in the middle of a busy intersection. There are buffers between the walkers and the bikers and the drivers. So this is something that communities are looking at to make a place like this, a downtown in a suburb or a town, become a better place to be, to walk to get around. Now finally, moving on to housing and healthcare. One of the trends that I think is really exciting in the housing world is that we're increasingly seeing connections between housing and well-being in all areas of life. We're seeing connections between housing and education, but housing and health is really taking off. And I think this is really exciting because it's acknowledging that housing is a platform for good health and quality of life. We see it happening with kids concerned about lead paint in the home and how that translates into how well they do in school. But we're also seeing it with older adults and thinking about how do we bring healthcare into the home. Right now, people who don't have a lot of financial resources often end up in nursing homes prematurely, and it costs a lot of money, and the quality of life isn't great. But how can we bring some of that money into the home to provide care in the home in a place that is cheaper for the taxpayer and for the homeowner or the renter, and supports a better quality of life? And so we're seeing increasing connections between HUD and Health and Human Services at the federal level. We're seeing it at the state level, and we're seeing some really interesting things just coming out of nonprofits. Because the care is expensive. Now these are national numbers, and I don't know if you can read them from where you are, but the median annual cost of a nursing home in the United States is $77,000. And just adult daycare at $16,000. Unfortunately, this is national, and Massachusetts is not in such, would love to have that number. The median annual cost of assisted living in Massachusetts is $126,000, and nursing is $134,000, which is closer to $11,000 a month. But if we can provide some of those supports in the home at a lower cost with aids and adult health care, that would be a good thing. The reason this chart is here is just to point out that the typical owner has so many more resources to pay for this than the typical renter. One of the things that we're concerned about is that at the center is the sort of the plight of low-income senior renters. A renter typically has enough cash to pay for less than a month of nursing home, and that wipes them out entirely. And that's when Medicaid kicks in and they're in a nursing home, even if they don't necessarily need to be. That's where they've ended up. So some of these programs that are trying to get around that are really promising. For instance, there's a program called Money Follows the Person. So what we have a lot of people in nursing homes that maybe don't need to be there, but they were renters beforehand, and by going into the nursing home because they broke their hip and they needed rehab, they've lost their apartment, and they can't come out because they don't have any place to go. So Money Follows the Person is a federal pilot that aims to set somebody up in housing, give them a deposit, give them some basic furniture, help them get themselves on their feet, and have some supportive services like care coordinators. Another model is SASH in Vermont. I don't know if anyone's heard of this. This is another sort of pilot. It's part of the state's Blueprint for Health, which is their health reform initiative. And basically, it's a program to help people stay in their homes, providing care coordination, check-ins, connections to community-based services, social opportunities.
What is the name of that program?
It's called SASH, which is Support and Services at Home. And
It's in Vermont?
It's in Vermont. It's a statewide program. And it is part of a Medicare pilot. But it's looked at across the country as a real model. Another model that you've probably heard of is the Beacon Hill Village model. This Beacon Hill really started the village concept, which is a bunch of residents in Beacon Hill decided that they wanted to stay in their homes as they aged, but they recognized that they didn't necessarily have the supportive services that they need. So they began an organization. It's a fee-based membership organization. And you can get transportation services, you can get household help, it's a network, you can get discounts on things, you can have social opportunities, recreation, but at the core of it, it's to provide a real network to, if you need groceries picked up, if you need a ride to the doctor, if you need this or that, you can go to that organization. A lot of villages have been formed in its wake, a lot of people are following, even locally. There's one in Newton, which is off the ground. Wellesley Neighbors, I know about because my in-laws were some of the founding members. And right now, it is primarily a social network where there's a lot of opportunities for getting together and learning and education and culture. But the intent is that eventually when people need it, it will be able to support a lot of this sort of connection and helping people navigate if you need a home contractor, you need the transportation. So these are all great models, and they're all very promising. And the last one that I didn't put here, but you may have heard about, is the NORC. NORC is a naturally occurring retirement community. NORCs are places where the majority of people are aging in place. Generally 50 or older, 50% of the people are 50 and older. The concept kind of came out of New York City, where there's a large apartment building, and like thousands of people in it. And the community in that apartment building recognized that people were staying, and 30 years maybe, and suddenly the population of that apartment building was much older, and they needed some services, and so they started an organization within that to provide many of the services that this does by a fee. So NORCs are all over New York City, all over big cities. There's no reason a NORC couldn't be in a community like this one, though. Whenever there's a population that of concentrated older adults to whom services can be provided, then it can work. So we see, whether it's called a NORC or it's called a village, both of those concepts are kind of converging, and they're both out there. The other model that we see for folks who may need some more support but are not yet qualified for an assisted living facility, or certainly not a nursing home, is the housing and services model. So this typically offers independent living plus some supports, some meals, some transportation, maybe a nurse who comes by once a week and can help with minor things, laundry services. So one of the big providers in the Boston area is Jewish Community Housing for the Elderly, and their housing is mostly in Boston and Brookline, but they've opened up a home in Framingham, for instance, that does that, and trying to sort of move out, I think, into the suburbs where there's also a lot of need. The last innovation in housing I wanted to talk about, in terms of also housing and healthcare, is that there is some innovation in skilled nursing care. The trend in nursing home use has been down. Even as the older population has grown over the last 20 years, nursing home usage has gone down. Typically it's still a very important part of the healthcare spectrum, but people typically are using nursing homes for very short periods nowadays. But that's not to say that it's not, of course, an important part, as I said. So the Greenhouse Project is a network of different nursing homes across the country. It started out by one person, this idea of this position was that people should age in a more home-like setting. So a typical nursing home looks like a home. It has maybe 12 bedrooms, all private. And the idea is that people get up when they want, they play cards when they want, they eat when they want. There may be a big family-style dinner, and the caregivers are integrated into that. So it's a much more home-like, personal, private setting. The cool thing about this, I think, is that because they're smaller buildings, there's some potential for them to be integrated into residential neighborhoods, and why not, right? So you could have one of these, it's not so institutional looking and it's not so large and it doesn't require a ton of parking, but it could be more integrated into a residential neighborhood. Some other things that people are looking at that could be useful out here, accessory dwelling units are small units that are either attached to a current home or detached and on the same property. That can provide an option for more affordable housing, more accessible housing. In terms of, a lot of communities are playing with these and they're big out west. For older adults, they're interesting because they can provide several things. They can provide additional income if you stay in your main house but rent this out. They can provide a home for downsizers, so there are stories of people moving out of their home, moving into the accessory dwelling unit and renting out the main home. They could be a place for caregivers as well. So there's a lot of options with these. They typically require some amendment to zoning because zoning typically says one dwelling unit per parcel. But there are a lot of communities around here who have experience with this. Lexington has a good program. Newton, we try. Newton is always stymied by students, college students, and there's a little bit of resistance to having accessory dwelling units that college students will then live in and party in. But especially in that is lower density, like here, that has more acreage per unit, that could be a possibility. And finally, housing in town centers. I mentioned before Newton's case, this is the parking lot on which they have just approved this project for 63 units of housing, which is a lot. I know coming to Harvard where that would be a lot, but I think it's a small scale village, but it's right near our senior center, and it's going to bring some retail, it's going to keep some parking, and it's going to bring some housing that is right across from a grocery store within a village that has shops and restaurants and is right on the commuter rail. So hopefully another possible solution. So I'll just close here, and then I would love to have a conversation. I would love to hear more about what's happening here and the issues that are here. But this is the census from 1990, and only a few counties had large concentration of older adults. Those are in red. Midwest, out Southwest, clearly Florida. By the time you get to 2010, this is what we're looking like now. And this is happening.
What's that age group of red?
50 and over.
50 and over?
50 and over. And it's happening for two reasons. One, the population of the country is getting older. And two, a lot of the young folks are leaving certain parts of the country. So certain areas, I think like Maine, the Midwest, that's turning red because not only are people getting older, but the younger people are leaving other cities. So in closing, we show this at the end because we want to